All right. Can you guys hear me okay? Give me like a thumbs up. Yay. Okay. So this is just general Medicare question and answer time. So people's questions go first, and then I got other stuff I can just add because sometimes that prompts questions. But the first question that we have and we are recording this, so we'll put up the recording on the Medicare events page so that the people who miss this event can catch it. So we got asked during open enrollment, if we're already on Medicare and the supplement, can we change anything other than the Part D? So the Medicare supplement, when you can change that in the state of California, is tied to your birthday. So the medical plan, birthday. Not every state has this, very few do. We do, part of why our prices are higher. But you can switch from, say, Blue Shield to Humana, whatever, to a plan equal to yours or lesser. You can actually do it any time during the year, but if you do it outside of the 60 days from your birthday, you have to answer health questions, can be told no, have a pre-existing look back. So we don't like to do that if we don't have to. And the Plan D and the Medicare Advantage plans are what we hear annual open enrollment October 15th through December 7th. That's the period when you could drop your supplement, go to an Advantage plan. If you have a drug plan, change your drug plan. But it's not anything to do with the Medicare supplement. That's a different anniversary. Good question, though. Does anybody else have a question? You can drop it in the chat, or being there's only 5 of us, you can unmute and ask your question. Otherwise, I could ramble about Medicare all day. Tina.
Hi there. Good morning. Thank you. Regarding prescription drugs, currently I'm insured with Cigna.
Which one? The Assurance, the Saver, or the
excuse me, let me read. It says, oh my word, Sig PDPRX. I don't know if you can see this card.
I know, but did you get a booklet that said, here's your plan this year, here's your plan next year?
Let me mute and go look.
Okay.
Sorry.
Because it's got the name. They don't put it on the card, which is annoying.
Okay.
Right. Do you know how much you pay for it? Then I'll know which one it is.
I'm one of those people. I do it and then I check it off and it just.
I know. This is where simple questions aren't simple questions, though, but go find it.
Sorry. Thanks.
All right.
It's on mute.
Who else has a simple question? Well, Tina finds hers.
Gary, but I do a heck of a lot of things and I just
I get it, but there's 4,000 of you and I can't remember, especially when last year all the Cigna plans were non-commissionable, so I don't track them.
Of course.
If you guys ask me what you have, on the drug plans, I may not know. There was very few people I could actually enroll. And this year we have one lonely drug plan left paying a paltry $12. So that's why we are not doing any individual drug reviews. We got it. There's no commission. We're not allowed to charge a fee by law. And so, when how stuff rolls downhill? Yeah.
Yes.
The Inflation Reduction Act put that $2,000 cap on those drugs. And then the drug companies lost their shirts last year because of that. And they were paying about 40% of the cost of the drugs, rebates, other things were paying the rest. Now they're paying 80%.
Oh boy.
Anthem Blue Cross dropped their drug plans. They're not even selling one. That's how toxic that pool is. That's how much they don't want to sell a drug plan at all. We're down to 10 this year. And, it's just going to be that way unless they finally figure out that the enemy was the pharmacy benefit managers. But I don't know that Congress will ever be that smart. So we'll see.
Okay, thank you. I'll go look. One moment. I'll be back.
All right. Anybody else has a question? Phil?
Yeah, in the meantime, if we're signed up for the in-person with agents, I don't have a working laptop or a pad that I can bring. Does that matter?
We can do some stuff here, but there's we have to go to Medicare.gov. One of the companies just pulled off of all of our platforms. We can't even see it on our normal stuff. So if you need to enroll in anything different, we may have to go get somebody to sit with you on their computer and put it in Medicare.gov, and you do it through them.
Okay, I may have it figured out by the time I get there. And
Okay. The challenge with the in-person day, there's 3 of us if we're all healthy, and we won't be after everybody comes in our office. And from 12 to 5, we're going to be here, and we opened it up and cut off the what we could handle at, 25 or 30 people. 10 people each, so it might be I go, you need this, we agree, you go sit with somebody and they help you. I mean, we're just going to try and triage and get you guys through because, yeah, there's not enough of us to do this. The other alternative, if you really need more hand-holding help, is always HiCap. It's a nonprofit that works through county senior centers. And the HiCap in Santa Cruz is 462-5510. And so they have people who volunteer. I have no idea from what educational background, who to sit down with people and look at Medicare.gov and try and figure out a plan. I cannot think of I eat lunch with a lot of the local health insurance agents. We have our kiss and cry lunch once a month and commiserate about crap. So it's not like I'm not friendly with the local agents, and nobody wants new Part D customers only, where you have a supplement and you're happy with it. You just want to review the drug plan. There is $0 in that for us. And if my staff does it, I have to pay them for their time. So I'll volunteer these hours, but I'm not having them do it, except for the 2 in-person events. That's it.
HiCap has been very helpful in the past with their
Yeah, HiCap is great. My own mother, worst client I ever had. She, when she was bemoaning these changes at work, and now I'm only working for my insurance, I'm like, you qualify for Medicare. No, that's not going to be any good. So I told her what she should do. She didn't believe me. She went to HiCap, and then she came back. Okay, we can do that thing you talked about. Yay, I felt validated. So, Rita, you had a question.
Yeah, if I don't have any prescriptions, what is the cheapest drug plan I can buy?
Health Spring Assurance, and it's free. You'll love it. That's the
Health
one I have.
Health Spring and not the Cigna anymore.
And they changed their name for God knows what
Oh,
reasons.
so the same one. Just keep it.
Yeah, if you're on Cigna Assurance, your booklet that you got says, now your plan is called this. You guys should
Right.
really read this stuff. It's amazing.
I don't want to read this.
I know you don't want to do it. I'm going to make it so you guys don't die in the wild.
Thank you
That's my
so much.
job.
Thank you so
Okay.
much for doing these things out of the goodness of your heart. I
No
really
problem.
appreciate you.
Yeah. All right, Tina, did you figure out which one you had?
Yes, I have the Cigna, and the premium this year is $1.80 a month. And then it's
So
gonna go to
that's
zero.
the same one that Rita had. So it's the plan that is the least expensive. It's
Yeah,
zero,
0.
right? So if the no drug people, no brainer. My parents had a couple of different meds and they were super cheap generics. It was still a no brainer for them to keep that plan. So it's the go-to when people tell me I take no drugs. Get this one, it's free, and then you won't get a penalty.
I take one, and I don't care if folks hear it. I take a Synthroid.
So since
it.
the brand name Synthroid, not
No,
covered
I
on
take the
any other
generic.
plan.
I take the generic.
It's covered on everything. Yeah,
Okay.
stay on that plan. Done.
Okay, so just let it, okay.
Let it ride.
Thanks so much, Pamela.
And Tina, weren't you signed up for one of the in-person?
No, I missed out.
Okay. All right.
I'm bummed out.
All right. That's all right. That's all we're going to do is eat. Well, I won't have time to eat snacks. We're having a charcuterie board. But it's probably going to be a petri dish of disease in here because every time we have one of these, everybody in the office is out for a few days.
No.
Yeah, it's not good. That's why we don't do in person anymore.
Gosh.
So last year, Journey was pregnant, so we tried to keep foot traffic to a minimum. We got people in here that have immunocompromised issues, so it's not good to have a flood of people run through here. It used to look like a methadone clinic every year, though. Rita.
I'm gonna say bye. Thank you so much.
Yeah, no problem. No
Yes.
other general Medicare questions that you want
Nope.
answers
You've
to?
got me covered. Thank you
All
so much.
right,
Bye-bye.
awesome. Bye.
Bye.
So it's drugs and the discussion today is just Plan D.
No, it's whatever questions
Oh,
about Medicare. This one is like open forum. Some people have questions about how does it work if you have durable equipment or,
okay. And may I
insulin
ask
supplies. Sure.
quickly? I have my Medicare supplemental. I have
Mhm.
Humana G, or excuse
Uh-huh,
me, not G. Yeah, the G.
uh-huh.
Achieve.
The Achieve,
Plus.
yeah, keep it. They
Great.
quit
So
selling it. I
I'm
wish I was planning on moving to it December when my birthday rolls around and they quit selling it. They have more people than they want now. So the companies, they have like a threshold of risk that they're willing to take,
of
which is
course.
smart on their part. This is how they
Mhm.
survive, like a
Yes.
cockroach, right? They survive. But once they get a huge influx of this people going because that one was underpriced, they're like,
Got it.
crap, I think we messed up. So they cut off. They sent out a cease and desist. Don't sign anybody else up for it. It's over. So,
Okay, Pamela,
yeah, keep that one.
okay, thank you. You're a lifesaver, and I'm so glad that you're my broker. And the folks
And I
don't
bet you're
know.
glad that you got out of this business,
Yeah,
aren't you?
so tell them I was an insurance broker for 27 years and retired 11 years ago. I referred, everybody asked me who to go to, Pamela, Pamela, Pamela.
Yeah.
I've done that for 11 years, but now
You were one of the more fun Medicare supplements to ride out at the fair, sitting on the
that was
grass.
fun. I
Yeah,
remember that. And you had your dog.
yeah.
Remember
So,
that?
yep.
It was a lot of fun. Thank you. I'm going to check out then. Bye-bye.
Okay.
Thank you. Bye.
Bye, Tina. All right. Anybody else? Phil, you look like you had a question in your mind.
Yeah, I have a question. I'm trying to pull it back out of the garbage can that is my mind.
All right.
Well, first, I wear compression socks,
Mm-hmm.
and I also am on CPAP.
Mm-hmm.
And Medicare sends me so much CPAP stuff that I'm having a problem storing it. But they won't send compression socks. It's something apparently they don't cover, and I don't quite understand that.
Yeah, I don't know the rationale to that either. You have Medicare and a supplement or the Advantage plan?
I have I have the supplement. I have Cigna, the
Okay.
180 plan.
But you don't have alignment or one of those. Okay.
No.
Because that is one of the perks of some of the plans. The Blue Shield Plan G Extra. There's
Mhm.
G and G Extra. You pay about $12, $10, $12 a month more for that at most age groups. But that has an extra little benefit for this over-the-counter money. You have to go on a website, order those compression socks through them. I hope they have the kind you like. And then there's some free money quote to spend on that. The free money that really costs you $120 a year, but it's free. Um, so that is in some of the plans as an extra thing. Medicare is not paying it. The extra benefit is paying for it.
I have the plan F extra, but
Okay. So
I don't
you
know
have
what.
an over-the-counter benefit.
Okay.
So you have to work with that. There's a website that they give you. You go to, you have like $100 to spend. Buy your compression socks there.
Okay, I'll check that
So
out.
anything that they have a whole list, but it's mainly any item you ever saw in the pharmacy section that's not prescription. So aspirin, Bengay, toenail fungus stuff, your diabetic socks, compression socks, Cane's walkers, right? Vitamins. Those are the things that are in that over-the-counter benefit. So yeah, utilize that benefit. Stock up on socks.
Okay.
I had
The
one
other
guy that bought it just for the diabetic socks, and he's not diabetic, but he just loves the extra cushy socks. I'm like, they give you $100, spend it.
the other thing is that came back into mind when I looked at the letter I got from the Cigna.
Mm-hmm.
Uh, they had changed in their formulary, instead of saying for tier 1 drugs, you'll have a $5 copay. I'm just pulling this out.
Yeah, you have to pay the deductible before that plan pays anything.
Right. But
Mhm.
once you pay the deductible, what they've changed from a dollar amount to
To
a
a
percentage.
percentage, right? That's some of the tricky stuff because they were hoping you didn't notice. But good on you, Gold Star Phil, for checking that out. I'm proud of you. So yeah, if it's something like, she was mentioning Synthroid or the generic of it, that drug cost $1, so it doesn't matter. But if it's something like Eliquis, that is used to be 600, but that was one of the drugs that got negotiated down. So people on Eliquis will pay much less this year. It is a percentage, not instead of $47, it might be 47%. And that's a big game changer. But you still have that cap of 2,000. But that happened on a lot of the plans, going from a co-pay to what they call co-insurance. You share in the cost. So if your drugs are cheap, my parents are on, again, very inexpensive meds. I don't think there's anything they take that costs more than $10 a month. And when I calculated out the difference between, say, WellCare, the next drug plan down, which is like 5 something a month, and it has no deductible on the generics. But they didn't call my parents' drugs generics. They called them brand, and they would have still had to pay the deductible. So it ended up being more expensive on that plan for the drugs and for the cost of the insurance. So everything is the formulary.
Mhm.
Your drugs are covered, that's a good place to be. So did you do the Medicare oh, you're coming to the in-person one.
Yeah, but
Which plan
hopefully,
are you on now?
I'm on the assurance, the
The
Cigna.
Cigna one?
Yeah,
Okay, so I'm
Cigna.
gonna pause the share for a second because there's some things I don't want to show on the recording. Let me go to which one of my 500 tabs that I have open. Oh, here we go. Not the tab that I want. Well, what's your last name? Remind me. Lynch?
Lynch.
Yeah. I'm just gonna run something really quick. So you had no drugs. Oh no, you had 2. You did have the Eliquis.
Yeah.
Okay, so I can see your list. Let me just run it real quick. Judging from that list, what you have is not the right. No, it still comes up the best plan for you because you're going to be paying out the $2,100 no matter what. I would stay on the same plan. There is a payment plan that they have that you can register for with now Health Springs. I'll be saying Cigna for a while. I still can't adjust. But they can say your annual cost is going to be this $2,100. So you pay us that broken out each month and you pick up your drugs for free at the pharmacy. If that helps you budget wise, that Medicare payment plan, prescription payment, it's the MPP3, I forget the initials for it, but it'll break that up. Otherwise, when you first go, the first few months of the year, you're out a tremendous amount of money and then it tapers off to nothing. But there is a way to even that out.
Okay.
Yeah. Your Eliquis, it's like $600 in January. And then it's $1, 186, something like that through August. And then all of a sudden it drops off to 0 at the end of the year. But if it helps, your other drugs are all super cheap.
I heard a few years ago that Eliquis was supposed to go generic, and then the courts let them keep it for a few
I
more
know
years.
it's odd because my father took it for a while and he's in the VA, and in the VA, even though you're in the United States, you get the generic. So the generic exists, but I wouldn't go buy the generic. The generic is not cheap. And now that they've negotiated the price of the brand, there's less of a disparity. So you still utilize your plan for that, but I think it would help you to file for that program so that you're paying HealthSpring every month a prorated amount, and you're just picking up your meds because the Eliquis is a permanent for you, right?
Yeah.
Yeah. So yeah, that's your expensive one. You're a cheap date otherwise, in the best sense of those terms. So any other questions?
I entered several in the chat box.
Okay, let me go look in the chat then. All right, gotta blow it up where I can see it. So we have got that one. Don't have any prescription. Cheapest was the HealthSpring Assurance. It is your date of your birth or 60 to up to 60 days after, not 61 days, not 2 months, 60 days. Seriously, they count. I've had people miss it by 1 day.
So 60 days from the birth date onward, not before.
Yeah, for the
Okay.
medical piece, if you're on a supplement.
Okay, thank you.
And then any advantage to resisting enrolling in Medicare Advantage. All right, so Medicare supplement versus Medicare Advantage. Actually got a little slide deck on this. Let me try and pull that up. I just did a whole little presentation on that.
I understand the concept, they're HMO, or I guess if you were still hanging with the PPO.
So it depends on how you use healthcare. I
Okay.
ask people this question to kind of just break the ice on it. If you were diagnosed with cancer, Parkinson's, would you want to go to Stanford, the Mayo Clinic, Cancer Treatment of America? If
Yes.
that's a yes, then probably staying on the supplement is your best bet. If you're okay, the pros and cons of it are the supplement a lot more expensive, especially as we get older. I have people paying $300-400 for those supplements. Medicare Advantage plan is $59. Right. So, I mean, that's very attractive. Drug coverage on it, epic, zero deductible on the plan that we have around here. But you have to be happy with, I'm going to go to my doctors at Sutter or Kaiser, whichever one, you're picking into. And I'm going to be good with those options. Now, they may, in the case of in Santa Cruz County, we don't have a burn unit. Every single burn patient that needs to go to a burn unit is not going to be treated by anybody here in Santa Cruz. We don't have a place for that.
Yeah.
They're going to refer you over to another hospital, in Santa Clara that can take care of that.
Yes.
And it's still going to be compensated for, even though it's technically, out of network. In emergency cases, that's taken care of. But for, they don't like to call cancer routine, but for, the illnesses that we all know that happen, if you're the person that's going to really want that freedom and flexibility, stay in a Medicare supplement if you can afford it. There was a place this summer. We have to start these trainings in June to be able to even talk about Medicare. And then we have to do this one major course, take this test, and then we have to do a training with each of the different companies. And then they kick us to the curb at the end. Such as has been for the last 2 years. But, in order to talk about it, I still have to do it. But there was a place in the summer when the cheapest drug plan that would tell us a price was well over $100 a month.
Yikes.
Trust me, we were excited when we saw this. Well, I don't care if you call yourself Cigna, HealthSpring, whatever, you got a zero premium plan. Because otherwise people like me who are not on any drugs, plus the government blisters me for making money, I should retire, then I have to pay $75 for my free plan, That's hard enough to stomach. If it was $100 plus the 70, I would have opted out. I'll take the penalty. Right. And I didn't really want clients to be in that position. So I'm happy we have a free one.
Yes.
So, but yeah. Other questions that come up during the year, if anybody thinks they can qualify for like the extra help for the drug plans, apply through Social Security. That's available all online. Let me see what other question.
Related, Pam, before you move on to that last question, in terms of the Medicare Advantage, enrolling or switching plans for original with supplement to Medicare Advantage outside of the birth date period, there would be a medical exam, medical history, in other words, what their risk is going to be, and hammer me for that. Then does that going to occur whenever I do it, or do you think going forward? I mean, it's hard to tell with this administration what's going to happen tomorrow.
It's not even this administration. The BS we're dealing with right now with not getting paid was the Inflation Reduction Act. Every administration will hammer me. I am like the kicking post
You're
of the government, regardless of who's in charge. I dislike them both. So I'm their worst nightmare because you never know how I'm going to vote on any given day. Just who ticked me off last, probably.
Yes.
Right?
Yeah.
So, it's both sides. This isn't political. They're both bad. And the Department of Insurance in California doesn't help our cause either. There's all kinds of really epic plans that are out there. They'll never get approved in the state of California, so you'll never see them. I go to these conferences, I'm like, how come nobody ever told me about this product, And they're like, and so now I've learned when I go to conferences on my name badge, I just put CA in big letters because they'll just go like this, and I don't have to waste time at that booth, right? I'm sorry. We do have great stuff and you can't have it.
Yeah.
So, but yeah, the Medicare supplement every year, I would look. We had this moment in time during the summer when the Humana came out with their Achieve product, which was no bells and whistles, like Plan G, no drug, no gym memberships, no extra benefits like we talked that Phil had, just the plan, right? And it was super cheap. So as people's birthdays were coming up, I'm like, hey, you should jump off Blue Shield or United Healthcare, wherever they were, and let's go over here. Some people were saving $100 a month, some of my older clients. So it pays to shop. And the answer may be that you're where you need to be. Well, you don't know if you don't look.
Okay.
So yeah. And so if you're just letting your drug plan ride, there's nothing that you need to do as long as it's enforced. I do have a couple of people who didn't pay their $1.80 and they need to reapply. Even though they applied, it has to be enforced in order to renew.
Sure.
Odd concept. PAMF will only accept new Medicare patients with Medicare Advantage. They will not accept new patients with traditional Medicare.
Okay.
And they only have one doctor in each of their 5 clinics that is accepting a new patient.
Oh boy. Okay.
Yay. But Dignity does the same thing. And the only Advantage plan that we worked with Dignity is gone for next year. So all of those people have to make the decision of keep my doctors and go back to original Medicare and a supplement, or jump to keep a Medicare Advantage and move over to Sutter. It's been 50-50 so far.
And your understanding, your knowledge is that PAF is accepting Medicare Advantage, at least most major.
They're taking their Alignment Sutter Medicare Advantage plan.
Oh, only that one. Okay.
Yeah, that's the only one. That's it's county by county, right? And in Santa Cruz County, we got 3 plans. Kaiser, obvious where that one goes, and 2 alignment plans that go to Sutter.
Okay.
So it has to be one of those 2. If people live in Sacramento, San Francisco, there are many more Medicare Advantage plans, but the more rural your county is, in Monterey, there's pretty much nothing. It's Medicare supplement all day long in some counties. If you're up on that Oregon border, those counties, they don't even know what a Medicare Advantage plan is. They've never seen one.
Yeah.
So the more rural, the less dense the population, the less competition in the medical practitioners, the less likely that Medicare Advantage is available or survives for long.
Okay.
So
the trend is, as I understand it, and please correct me, is that the federal government, whoever the administration is, would prefer to privatize and have everything.
Absolutely. For mathematical reasons, I fail to understand, other than they've offed you all.
Yeah.
This I understand possibly the beauty of, right? Because if you choose a Medicare Advantage plan, you've said this to the federal government, you're out of my life, the money that I give you and that I've paid into the system, hand that money over to this private company, and now they are your Medicare.
Yes.
So people still think they have, but I have Medicare. I pay them. No, you gave that money to whoever.
Yes.
And so not having that risk on the books probably favors, the federal government,
Of course.
but they do pay more for it. So Dr. Oz is a real big proponent of Medicare Advantage, but Dr. Oz has never lived in a rural place where there isn't some. And so I do belong to the National Association of Benefit Advisors, and they're just had another face-to-face meeting at a big conference with him saying, here's what's happening in my state, in my area, because these politicians have never, ever had to buy an insurance policy in their lives.
Yeah.
They don't know how to spell some of the words we have to spell. They've never had to use Medicare.gov. They're never gonna. And, the biggest decision is maybe out of a little booklet of, plans that are offered by the government, choose if you want Kaiser, Blue Cross, whatever. But they've never had to really go it alone. And they've essentially kicked everybody out to the wolves as far as you should be able to do this yourself. It's so easy. They said that about the ACA and how brokers were going to be irrelevant. And we did 85% of the enrollments because nobody knew how to do it.
Yes, of course.
So, will it come back? I don't know. Maybe. Will I still be working when it comes back? I don't know. Maybe. I got Medicare with you guys. I'm not a spring chicken.
Yes.
So,
And is there a risk of the medical history to convert to Medicare Advantage as that we move to that trend and that?
No.
Okay.
You sign up for whatever you want during open enrollment. There's no health questions.
Okay.
It's an absolute positive. You submit it, it's yours in the right window of time.
Yes. Okay. Thank you.
And then you just have to remember to go cancel your Medicare supplement, because I have had people who jumped and they forgot to go back and cancel. They think it's automatic, like the drug plan. You get a new one, it cancels the old one.
Yes.
It doesn't. Medicare supplements is in the private world solely. They have to do what the government says is these are the restrictions, but they live out on their own. They don't communicate. So Medicare doesn't say, oh, hey, by the way, this person went over here. They don't get that feed. You have to tell them.
Okay. It's all right. It's not.
Yeah.
Thank you, though.
Yeah. It's really bad when you find people who have been paying for both for years and they're getting nothing out of their supplement because they don't have the underlying Medicare. Any questions about that maximum? The 2026 Medicare and You booklets got mailed out, so you might have gotten a big thick booklet from the government. If not, it's available online. Honestly, that's the Bible. You guys ask me questions, I look it up. So there's a really good app you can put on your phone called What's Covered. So you can go to the Google Play Store, Apple Store, whatever you use. And it's kind of cool. It's got a big M on it for Medicare. And you can type in flu shot. Oh, it's covered under Part B, your CPAP supplies. Oh, it's covered under this, under these circumstances. You can, I get questions every once in a while. What was the last one I got? Is a yellow fever shot covered? I'm like, brought back bad memories of being in the military. Yellow fever, that one was brutal. I don't know. So I go to what's covered. No, it's not covered because it's not medically necessary in the United States. So here, I had a smart answer. I just Google, I just looked it up on the app. So you can answer some questions for yourself there. Do both of you have a Medicare.gov login?
Yes.
Good. There's you lose your card, you can order a new one, printed temporary. I don't know where I am in my deductible. Boom, there's the answers. I don't know if that bill ever got done. Boom, all your claims are in there. So teaching people how to use that this year, it's like your bus defense. It's your personal information. And it's always interesting. People think, oh, I've paid all this toward my deductible. When they look in there, oh, you've paid $50. You haven't even met the 247 yet. It seems like it when it's $10 here and $5 there, and I'm just writing checks all the time. It's like, It added up to $50.
Mm.
So that was my mom's situation this year. Oh, and there is a high deductible Medicare supplement G that is like my parents are 88 and 90. If they got the full plan G, it'd be $350, $400 a month for each of them. They're under $100 on the high deductible plan.
Mm.
So they have to take the risk of the first $2,700. But in all the years they've been in Medicare till now, only 1 year that each of them have met the deductible.
Mm-hmm.
So they save way more money than they're ever going to spend. So if you're a math nerd, that one makes perfect sense.
Well,
But
you
if
have
you're,
to pay, sorry, go ahead.
that's okay. If you're the person that's like worried about all those nickel and dime claims and I don't like looking at it, that's not the plan for you.
Yeah. For me, I'm approaching medical insurance similar to other insurances, home, car, etc. Umbrella. What is the worst thing that might happen to me with my lifestyle, my medical history, family, so forth? That's how I buy my policy. So yes, I lose money each year, a few $100 on my plan B, because if I do get cancer and I am, and as I said, prefer original Medicare with supplement because of the flexibility to get top providers.
Right.
I actually am glad I have that plan because now I'm using it up the wazoo.
Yeah.
So,
a lot of people approaching 65, insurance got so expensive
yes.
that we all got the super high deductible plans and put off as much maintenance. So I had like the deferred maintenance people, you know, hadn't had a pap mammogram, none of that in, years. We're afraid of finding anything, afraid of the cost, afraid.
Yeah.
And then they get to Medicare. I had one client, oh my God, I'll never forget her. She went crazy. She had the plan F because it was back in the day. And she would be like, she would call me up at least once a month to tell me how cool this was. And she got this and I'm like, great, Linda, you don't have to tell me all your stuff, but I'm glad you love it, So, she just like, I'm going to get this and I knock yourself out, But, she would never be the person that a high deductible plan would be good for. And I have one little Italian lady. She overpays for her plan F, and she will overpay till the day she dies. I will never convince her mathematically she could save like $2,500 a year just by going to G for a $250 deductible. No, not going to do it. I quit asking at this point on her. I'm like, I know you're not going to change, but it's still there. No, okay, fine. That's the end of our conversation.
Thank you.
Yeah.
So,
Any other questions? Late enrollment penalties, vaccines?
I have a question. When you were talking about the burn centers, it reminded me that we in Santa Cruz occasionally have to get helicoptered to a trauma center. I have Air Medicare. It's not terribly expensive.
Yeah.
And it's supposed to pay for that because helicopters can be ridiculously expensive. Do you have anything to say about that?
There's actually a publication that Medicare has on that. What did they put? I think it's under ambulance. There's a government little thing that they put on that area. Ambulance services will always go directly to the source. So part of what, when it's truly emergency, right? It's always clear. We have people that use ambulances like Uber. I give you these scenarios, they're all real out of personal experience of listening on the phone. There was somebody who was highly obese, elderly couple, the other partner, no way can move other person. Can't exactly just call Uber, but needs to get to doctor's appointment. So he called an ambulance. They took her. And, you know, they got a huge bill for it because Medicare won't cover it because it was not an emergency. So the emergency component of it is true. So here's all your, you know, coverages. The air ambulance, I have seen it covered. Medicare may, you know, pay for airplane, helicopter if you need immediate rapid transport. So if you're in a car accident and the air ambulance is called and they scoop you up and take you to Santa Clara to the trauma center, and then you're released that day, you're going to get a bill. If you are admitted in the hospital, you needed to burn whatever, you're probably not, because clearly that was an emergency. So it's not just the thing, it's why did I use the thing? But I mean, having what you have, I have a lot of clients that ride bicycles, like, you know, Tour de France kind of stuff, you know, they're out on the road for hundreds of miles. And I have ones that like motorcycles and jumping out of perfectly good planes. I would recommend that plan that you bought to them. You go out to Hollister Hills and ride your, yeah, they're never going to send a land ambulance out there. It's too remote. They're going to send a helicopter. So, but these are really good things that, you know, you can look up. These are in like the Medicare booklet. It's just easier to look it up this way. That's a good question, though.
Pamela, can you hear me?
Yes.
This is Suzanne. Hi. So with Plan G, and I'm embarrassed because I should have researched this more in detail, but do all of them really cover the basics? Or are they very different, or they do have to meet a
They're
certain
all identically
criteria?
the same on the
That's what I
medical
thought.
side. Yeah.
On the medical side. Okay. And
So they can have some extras, like Phil has one that has some extras in it.
Yeah.
But they all have to cover the same thing. So this is the brochure that I did. Some of you have probably seen it or gotten it in person, but it gets edited every year. Takes a while to come up when I got 50 screens up. So I'm not allowed to change this chart. If I would make it make sense, which the government won't let me, instead of benefits, this would say, these are the holes in Medicare because these are the holes in Medicare. Your Plan G, don't care who you bought it from. Plan G fills all the holes except for this one.
Which is which one?
Part B deductible.
Oh, that's right. Okay.
Right?
Yeah, I did see
So
that.
that's
Yeah.
a Plan G by law.
Yeah.
Government says they're standardized.
Yeah.
Right? So
Okay.
now Phil has a Plan F and he has F extra. So Phil's extra is he has the gym membership, but it doesn't change anything about the medical. Right? Your doctors are not billing Blue Cross, Blue Shield, United Healthcare on the supplements. They are billing Medicare. Medicare's
Right.
adjusting the bills. And so maybe the doctor wanted $500 for the, you know, exam that he did on you or she. And the Medicare's like, isn't that sweet? You can have $125. So that's where you see the not allowed column and people freak out. Don't worry, they don't pay taxes. It's funny money. The 125. Now, did you meet the deductible? No, you owe that 125. Have you met the deductible? Yes. If you have the Plan G, you don't, when you get those things that say you may have to pay, this is not a bill. I swear nobody sees in the giant letters of this is not a bill, and may is in bold print and underlined, and they still don't see it. They think that's a bill. So that's just telling you in advance, you might get billed from your doctor for this amount. And if you don't, it's because you met that already.
The deductible.
Yeah.
Okay.
Okay.
So, okay.
Good question, but they're all standardized by law.
Okay. And when you said F extra, what did that mean? What is that? I mean, you said
it's a plan that you can't buy now, so don't worry
Oh,
about
okay.
it.
Okay. Okay, never mind.
There's G extra in Blue Shield. There's a G and there's G extra. It's G with a little packet of extra goodies attached to it. You pay about $10 a month more for it.
Yeah.
In most cases, maybe 12. but it included something like silver sneakers and,
Right.
you know, something extra.
And is that not available?
It is, if you want to pay
Okay.
for it. And you can switch from a regular G to those extra plans from your birthday to 60 days from your birthday without
'Cause my
any health
birth-
questions.
My birthday is the end of this month.
So you could look at that, call and make an appointment. I don't want to do it online because it's
No,
everybody's
that's
personal
fine.
stuff,
Okay.
right?
Okay,
But,
right. No, I gotcha. Okay, perfect.
but we can take a look at it and you can decide if the extra has
It's
that
worth
a
it.
benefit that's worth paying $10 or $12 a month more for.
Okay. Okay. That's
For
super.
some
Thank you.
companies like United Healthcare, their extra is already built in, but
Yeah.
that's why they're slightly higher price than say just the standard Blue Shield. So
Right.
sometimes if I'm looking for a gym membership and my gym participates in what they have, or
Yeah.
there's, you know, like that over the counter benefit, I'm going to go online and spend that money. Like Phil's going to go buy himself some compression socks, you know, so that's great. For me, I couldn't use $100 worth of Band-Aids or anything that would make that worthwhile to me. So
Right.
I don't buy it. I just have plain old G, right? Works for
Yep.
me. And
Okay.
honestly, at whatever point I retire, I'll probably go to the high deductible G.
Yeah.
But now that my boss is paying for it, sure, plan G.
Mhm.
Compared to what I was costing him at 64 in the group health market, they love me.
Oh, wow.
It's
They
okay.
love you. Yeah.
Yeah.
What cheap date.
But I mean, I've done a bunch of stuff this year. Had my pap mammogram, a bone density test, took a couple of classes about, you know, bone osteoporosis kind of stuff. And I'm not even out $100 yet. You
Yeah.
know, so I haven't even met my deductible. So Medicare, you know, love it.
Yep.
Happy
Okay.
that I made it that far.
Thank you. Thank you
Yeah.
very much. Okay.
Okay. Any other questionnaires about Medicare in general? Doesn't have to be at the drug plan, although it can be.
I have one. Yes.
Okay.
It's Suzanne. I don't know why my business name is still on there, but it is. So my question is, I am very inclined to look at the plans each year and see if it might be something better for me. Again, I'm original with supplement. I'm with Blue Cross Blue Shield, California right now with a G. What companies does your company represent? Is it the major ones?
Most of them, Blue Cross,
Okay.
Blue Shield, Humana, United American. There's another United something. There's 4 Uniteds. So when people say United,
Yeah.
narrow that down. Humana.
Alignment? No, yes.
Alignment is the Medicare Advantage.
Oh, okay.
So I thought you were asking just
Yeah,
supplement.
yes,
Yeah.
I am. Yeah.
So this, this is just.
Because I would like to work with you. You helped me a lot when I moved back to town and you helped me get my prescription drug choice, which has worked out well for me.
Under here. So this is what I look at. This is my site. So this already has like your date of birth and stuff in there. But if I want to do a quote and I want to look at Medicare supplements, and I want to look at an 11/1 date, but this won't be right for you because you can't really look till February, right?
Correct.
But I can tell you what it would be today, but I'll say it's guaranteed issue, but today it would not be.
So in other words, at my birthday, once I'm in the calendar year, the plans for 26 aren't necessarily going to be the same prices.
The supplements, the only thing they do on calendar year is that the Medicare CMS says here's what the deductible is. So the 257 this year is 288 next year.
I see.
The 185 you're paying is 206.50 next year. So the Medicare dictates that on a calendar year basis, but your supplement's tied to your birthday. So here's a bunch of different companies, Plan G, you know, and what they cost. So you can see there's a huge swath. There's 230, 312, 315, 342 at ARP. But Blue Shield is here, 277.
Mhm.
So here you could save about $20 by going to Anthem. I'm not set up with Aflac. In Manhattan Life, nobody's been able to really give me a comfort with that one. I've learned my lesson. Being the first adopter can often backfire. So I haven't gone there. So of these, Anthem, United American, Blue Shield, Cigna, Aetna, I am Humana. I'm with all of those.
Okay, thank you. I will see you in February.
Okay. Awesome. Any other medical, Medicare?
Well, Pam, what you just answered to the previous Suzanne, in that list that you just outlined, you didn't say United Healthcare.
It's down here.
Is it on there?
Yep.
Okay, rock and roll.
They listed as AARP, United Healthcare.
Oh, okay, gotcha. Okay,
yeah, and they always throw themselves to the bottom because most companies take rate increases, right? So you start out at like 150 and each year it gets more expensive. United Healthcare has this psychotic way they price it. They say 80-year-olds cost this. And I will give you a 32%, a 27%, right? The discounts go away, but the real price was always the high price. In the end, it's the same stuff. But you're losing a discount versus gaining a price. It's two different ways of saying the same thing, but it makes the quoting systems insane. So it's why it always will throw, even if AARP had the best price, it wouldn't be at the top. It's always in the bottom because they do something weird. So
okay, it doesn't mean anything really.
it doesn't mean anything. It's just,
gotcha.
It's two different ways of doing the same math. And computers are meant to go linear. So.
Yeah.
Have all those companies been sanctioned by the feds for encouraging or forcing their PCPs to recommend specialists? I know several of them have, United being one of them.
That's on the Advantage side.
Yeah.
Not the supplement side.
So,
so when you see a lot of issues, the best thing you can ever do for yourself, it's the product first. Who you get it from, absolutely the last thing you have to worry about.
Okay.
So if you hear something, United got hammered for this, what product was it?
Okay, thank you.
Chances are good it was Advantage Plan.
Yeah.
So one of the reasons why there was so much uproar around the time that their CEO got shot was that CEO was responsible for being an early adopter of AI. So when doctors put in these claims, there's a code for the diagnosis. There's a code for whatever the heck treatment advice, whatever they gave you. There's all these codes. There's dates. Let's just say there's a lot of hooey, not, a typo. Date birth doesn't match. This code doesn't go with this diagnosis, right? Stuff. It's a computer, right? There's no humans. People think like, oh, somebody's in there rubber stamping it. No, garbage in, garbage goes out. Claim denied, try again. So it's not that the claim won't get approved, but it's going to get kicked back with some information that the billing people need to see, oh, that's right, sorry. That was the wife's date of birth, whatever, And when on the second pass, 90% of those get approved.
Yeah.
So often it's a data entry issue. And Advantage plans, you do have to go to your primary and you do have to get referrals if it's a HMO. That's on all HMOs. You can bitch all you want. That's how an HMO works. And honestly, even on the PPOs, I have people who pay big bucks to buy a PPO. And then they find out that didn't help them either because the person they want to go see is requiring a referral from the doctor. Why are you coming? Like, where's your medical records? Like, don't show up. You can't just show up and go, hi, I'm Suzanne, and I want to talk to you about my bunion or whatever, right? They have to have that referral. So they're mad that they paid all this money for a PPO and they still needed a referral. The insurance didn't require it, but that doctor wants to know why the heck you're showing up and where's your supporting documentation so they have something to work with.
Yeah.
So, but yeah, product, who you get it from, totally secondary.
Okay.
So, but yeah, these have not been sanctioned because these are dumb. These don't make any decisions. Medicare adjusted the bill. Medicare said it was covered or not covered and how much doctors got paid for that. Medicare did all that. I have pets, so to me it's a pooper scooper. If you don't have pets, it's a broom and dustbin. So you can relate to one of those two concepts, right? Stuff falls on the floor, you pick it up. Done, right? That's how Mutual of Omaha, Transamerica, these life insurance companies can sell Medicare supplements. They don't need to know how to spell any of that. The Medicare just says, you owe them this much money, they write a check. Life insurance companies know how to write checks. So it's a different world than Medicare Advantage.
Mhm.
Good question, though. All right. Any other questions? We got 5 minutes left if you hit me now. You know, I'm never off the phone usually. I got it on silent right now. It's rung twice since we've been doing this. If not, I'll let you have your time back in the day. But Medicare.gov, your friend for your own personal stuff.
Mhm.
You can research your drug plan there, and it's pretty simple. Let me just do one quick example. Oops, forget.
But look up lobotomy.
So on that app, I'm not sure. I think it's if it's medically necessary, they qualify it. Sometimes they'll say, it's like, it depends. Like chemotherapy. We're only going to give chemotherapy to somebody who has this cancer, right? I mean, it makes sense. So there's a lot of things of it. Yes, it's covered, but you got to read the rest of the paragraphs. Ozempic, it's a classic one right now. Everyone wants to lose weight. So they all want to get Ozempic, you know, whatever, Zepbound. And that is it covered? Yes. If you're a diabetic, right? If you're not a diabetic, it ain't covered. So there's always you have to look at the whole paragraph. So I was just going to pull up an example here. See if I can crack into it. I don't always remember the password to this one. Ah, system maintenance. Love you, government. Yeah, thanks. Try again later. So apparently they're having a meltdown. So I was going to log in and show you some of the things that you can do when you're in there, as far as looking at your claims, ordering a new card. People call me for stuff when it could have been biff, take 2 seconds rather than make an appointment. So it's a really handy tool. Make sure you have a username and password for yourself for that.
Good.
Right.
You're wonderful. Thank you so much.
Yeah, no problem. So we're doing a few more of these, you know, before the end of open enrollment. The next one is for people who are curious about Medicare Advantage. And then we have the in-person event on the 25th. And then how to do Medicare.gov is the next one, and it's on the 2nd. So you can come back to the same one if you want to see any of those. When it comes to supplement versus Medicare, I just give people the facts. You tell me what you want, right? I don't have any skin in the game, one decision or the other. Everybody has their own set of criteria. I'm personally super cheap. And would I go to Stanford and do like exotic things? Probably not, but that's my MO, right? So, but for now I have a supplement because the first year in Medicare, it's cheap. As I get older, I may make a different decision. I have the dilemma with my parents every year, supplement or take them over to Advantage. When they neither one of them had any medical thing go on forever. Dad has access to the VA, so all of his drugs and stuff were coming from them. And a year ago, they both had a major outage. Both of them different, but you know, never been sick. Now broken hip. You know, in and out of hospitals, COVID, whatever. So they both hit their deductible that one year. This year, they haven't cost hardly anything on that. They're now in assisted living. That's a whole nother conversation. Medicare does not cover long-term care. Don't plan on it. That's on you. Unless you're poor enough to qualify for Medi-Cal. So it's 11 grand a month. So
When you were talking about evaluating plans, one of my criteria has become, especially since my husband passed away and my son lives on the other side of the country, how easy is my insurance plan, my medical care to manage, to administer?
Right. And that's where sometimes, honestly, the Advantage plans are easier. I have one notable client that comes to mind that, yeah, the whole concept of a supplement, a drug plan, it's a guaranteed would mess it up, right? Just 3 bills, 3 things, it's not in this guy's wheelhouse. Like, it's not going to happen. So when we were making a recommendation, I'm like, what's more important to you, this freedom of choice or simplicity? And your doctors happen to be in this network. Simplicity all day long and cheap. Great. So we went the Advantage plan for him, right? And I have some people, I mean, the alignment plan, I probably have 150, 200 people out of 1,700 that are on that plan. And maybe 5 over the years have complained and wanted to go back to original Medicare. And it was always some really bizarre reason, like, one guy was a violinist in an orchestra and he had something going on with his hands. He needed a hand surgery and he didn't want the specialist here to do it. There's a guy who's a violinist in an orchestra who's a hand surgeon up in San Francisco. He wanted that guy, right? And so that was one of the freak years where one of the Medicare supplement companies said, I'll take anybody, right? Even if they're leaving. So he got lucky. We could switch him out. And as soon as he had his hand surgery the next year at open enrollment, he went back to his alignment plan. I'm like, okay, if you go back there, there's no guarantee that that weird thing that we did for you will ever happen again. Just so you know, be good with what you're choosing, But $59 a month is pretty hard to argue with. Zero deductible on your drugs. Kind of a sweet plan. And if you're one of the people who can't get a doctor, it's the only plan. So.
Okay.
All right. I'm going to let you guys have your day back then, and I'm going to go to lunch.
All right.
All right.
Thank you very much.
Thanks for joining me. Bye.
Bye.